There we go. Yes. So this this whole online symposium is part of a bigger project that University of South Wales has. And first campus, there's all three campuses are involved, four campuses are involved, of bringing arts therapies into communities across Wales. And this is part of the Cultural Recovery Fund between USW and Merthyr Leisure Trust. And we have one of the program managers here, Natalie Kendrick-Doyle and Jane Ellis. So if you have questions about the program, we're going to be posting some of the workshops. Sarah is leading some art therapy workshops and therapeutic arts, looking at the role of the visual art in therapeutic processes. So without further ado, I'm going to present to you Sarah Challenger.
Okay, thank you. Hello everyone. Let me just get my PowerPoint up. Okay.
And just to say while we do that, you can always pop questions into the chat. We'll have a chance to ask Sarah some questions at the end of her presentation, but you can write questions as you go, and I will filter these through to Sarah at the end. Thank you.
Okay, fab. Thank you. Thank you, Tania. So I'm here to talk about art therapy or art psychotherapy. I am an art therapist myself. I work at the moment, I work part-time at USW, and then part-time I have a private practice. And in that private practice, I see private clients, but I also have a company with a clinical psychologist, a music therapist, and between us, we have contracts with some of the local councils, working with people that maybe are in social services. And we also work with an organisation currently that works with care leavers as they're transitioning independent life. So that's just a little bit about me and what I do. So in terms of the structure of today, we're going to look at the basics first. So what is art therapy? Who is it for? How does it differ from therapeutic arts and art for wellbeing? And what art therapy offers, and what the art offers as well, in addition to therapy. And then I've got a little short creative exercise for you all to partake in. It's perhaps not as immersive as it would be if we were in person, but hopefully it will still give you a flavour of maybe some of the things that we could do or we do within art therapy. And then I've got two examples from practice, and I'm going to try and get through everything in order to show you both examples today. But it might be that I end up just doing one. We'll see how time goes. Okay, so what is art therapy or art psychotherapy? And the two terms are used interchangeably. Some people prefer art psychotherapy and some people prefer to say art therapy. It really depends. Art psychotherapy, in terms of the label, suggests and references the fact that it comes from that sort of psychotherapy, that talking psychotherapy. But often people just refer to it as art therapy. I actually use the both interchangeably. It often depends how lazy I'm feeling. If I'm feeling a bit lazy, I tend to use art therapy rather than art psychotherapy. And it also depends who I'm talking to as well. Some clients find the term psychotherapy a little bit challenging. I had one client say that, does it mean that he's a psychopath because it's got psycho in the title? So it really depends who I'm talking to and also how weirdy I'm feeling that day. But BAT, the British Association of Art Therapists, this is what they say art therapy is. This is their rounding statement. So art therapy is a form of psychotherapy that uses art media as its primary mode of expression and communication. Within this context, art is not used as a diagnostic tool, but a medium to address emotional issues which may be confusing and distressing. And whenever I'm asked to describe what art therapy is, I often use the analogy that if you think of that very traditional therapy setting that you maybe have in your mind's eye of two people sitting opposite each other, one maybe lying down on the couch, we don't do that in art therapy, but that sort of conversation between two people, that is essentially what art therapy is. But in the middle of us, we have the ability, and we use artwork to further that conversation. It's another part of that therapeutic conversation. It's another part of that conversation you're having in therapy. You talk through the art, not always. Some people just like to talk, and the art becomes a sort of a presence in the room. And sometimes people only use the art, and the art is the entire conversation. So it really depends on the client and the person that you're working with. And I think what's also really important is that sentence about it not being a diagnostic tool. And I think that's something that there's a lot of preconceptions about art therapy, maybe more so than some of the other modalities. And one of the things that I think people often worry about is, oh gosh, if I use red, is that going to make the art therapist think I'm really angry? Or if I do this, is it going to mean it's something else? So we don't use art in that way. It's not about diagnosing something through the art. There's been a couple of studies, research studies, where there's indicators within the art of certain things happening or certain experiences that the client may have had being present in the artwork. And we absolutely use what's drawn and what's made to help that conversation, to further that conversation through the artwork and through the people in the room. But it's not about diagnosing it. And there's no, you use this color or you work in this way and it's an automatic that it's something else. Because colors can mean something to different things to everybody. For some people, red absolutely could be that anger color, but for others it might be associated with their favorite football team, for example. So it might be a color that actually brings them a lot of joy, depending on where their team is at the moment. So it's about the client's understanding of the art and what they're doing. That's really important, and it's always about checking in with that and checking in why they made those marks, why they thought about what they did, why they picked the colors they did, what it represents to them, not what it represents to us as the therapist. We can't move on, hang on. Okay. So in a little more depth, what does it mean when we look at that statement? So for us as art therapists, art is absolutely used as a form of communication. As I said, it can either be the sole form of communication in the room, or it could be something that's used alongside the talking and the other communication that happens in the therapy room, including sort of how maybe the person is sitting or how they are interacting in the room is also part of the communication. But art plays a really big part of that conversation. It's part of that modality. The thing that I think is really important to understand about art therapy that maybe differs from any other way that people use art is it's not about creating the perfect piece of artwork. It's really about the process of making, and it's about what that artwork holds. Something that it's not about creating something that you put on the wall or something that you show others. It's about creating something that means something and holds something to you as the client, but also to the therapist as well. You hold that space and that artwork together. And so the end goal of the artwork that's made in art therapy isn't to create something that someone's necessarily going to take home and to put on their walls or to show off. And actually, ordinarily, the art therapist will keep the artwork, and they'll keep the artwork until normally the end of that particular block of work. And if the client doesn't want it, then there's often a contract in place to say whether or not that artwork is going to be kept for a little bit longer by the art therapist and held for a little bit more. Because there's a lot of emotion and there's a lot of thought and there's a lot of experience held in that artwork. So when the art therapist is able to hold it and keep it for the client, there's a real power to that. And there's a power to the art therapist being able to hold something for a week. If you've brought something to a therapy session, which is really difficult and really challenging, the fact that the art therapist is, and you've put it in the artwork, the art therapist is able to take that information, that experience, and that artwork, hold it and keep it safe for a week, can have an element of relief to that person, to know that someone else is holding it along with them and carrying it along with them. As we've said in sort of the other sessions today, as with music therapists, all art therapists are HCPC registered, and it's also a protected title. That means that unless you've done the requisite training, unless you're registered with the HCPC following that training, unless you're keeping up your standard proficiency, you're not allowed to use the term art therapist, and you're not allowed to say that what you're doing is art therapy. And I think with art therapy, it can become a bit of a challenge, because there's so many things that use the title art therapy that isn't actually art therapy. So it is really important for us as art therapists that we're really able to hold what it means when we say that we're an art therapist and what art therapy is. Okay, so the easy answer to who art therapy for is for everyone. Before I started my training, I really sort of thought, well, when I become an art therapist, I want to work with children. And if I don't work with children, then it will probably be women. That's who it will work best for. The reality for me is that I often end up working with in older adult services and with men. So it's really opened my eyes. The more I work with different people, the more I realize how absolutely true that art therapy is really for everyone. Everyone can engage with it. And engage in a different way, depending on who you are, in the same way that everyone will engage in something differently in whatever it is in life. The maybe only caveat of everything, if everyone is very, very young children who probably don't have the same cognitive processing that as they get older they'll have with their babies. But that being said, there is very much an argument, and it is something that I have been looking into recently with some of the people I'm working with, of actually using artwork within the therapy session, but with a mother and baby. And so actually it's about, in that case, it's about connectedness, and it's about that bond between caregiver and child. So I would say that really art therapy is absolutely for everyone, and everyone can engage, and maybe they'll engage differently. One of the first things I'm often said when people are suggested that they do art therapy, normally within a service, is, oh, well, I can't do art. And as I said, there's no need to have the ability to do art. It's not part of what we're doing. We're not teaching techniques. You don't need to know a particular thing. And my argument is that everyone actually can do art. It's within us all. We might not all be artists that are going to hang on art galleries, but that's for me isn't about what art is. It's about making and expressing through that medium. So I think we are all artists. Okay, so to go back to the sort of how does art therapy differ from using art as an artist that might promote well-being, and a lot of art therapists do also work within the realm of, say, arts and health or arts for well-being, but they do so knowing who they are in the room and knowing that title. So it's not to say that as an artist you absolutely can't work at doing art for well-being at all, but it's just that maybe art therapists do the two things. When you're working in the realm of art for well-being, whether it's with an artist or whether it's as an art therapist, what you're working with is that well part of the person. So it could be that you want to create a sense of pride, or it's about social inclusion, or it's about giving someone a skill. It's something that bolsters that well part of that person, because by bolstering that well part of the person, it's able to support maybe the not so well part of the person. But when you're looking at art for well-being, or when an artist is using art in that way to promote well-being, they're very much in this realm, in the realm of the well part of the person. It could also be about creating a motivation to work or to achieve. And it could also be about team working or group working and finding your place in that group. And so, but it's really about that well part of the person. As an art therapist, when we're doing art therapy, it's about meeting that well part of the person and absolutely working with that. And some sessions, that's what you're working with, because it's really important that that's able to grow, that well part of the person. But you're also working with the not so well part of the person. And so could be the part of the person who's experienced trauma, or who is in a period of depression or anxiety. And it's a chance to process some of those difficult feelings or some of those challenging things that they're facing. It can also start to help them understand the events or what's happened around a trauma or what's happened around an experience. But it's important to know that they're two parts. So that's that well part and that not so well part. Because actually by working with that not so well part, you'll maybe able to release some of those emotions that can become really overwhelming, and you're able to sit with them and you have a knowledge of what that might be for that person. And also you have a chance to understand their experience and what it feels to them. And I think this differentiation is really important. We've got a lot of books out there that call themselves art therapy, and they are great. They're the colouring in books. I know a lot of people that I have worked with as an art therapist have had a lot of benefit from them, but it's just important to know that actually that in itself isn't art therapy. It's therapeutic. and it's great, and it's working with that well part of the person, but it's not art therapy as we would do as an art therapist. Okay, so what does the art offer? So when we're in a therapy session, what does it offer in addition to that talking therapy? And for me, the biggest thing that the art offers is it offers a way of telling without talking. And by that, I mean that you're able to express, or you're able to say some of that internal experience and that internal sort of thoughts and feelings. You're able to express them and present them and bring them into the room without actually having to verbalize them and without having to say them. And that can be a really important trait, because for some people, for example, who have experienced very early challenges or difficulties, actually, they might not have the words to express how they're feeling. And they might not have had it at the time, and they might not have it now. So actually, it's a way for them to bring it into the room and for able to explore it and think about it without needing to find the words. If someone has experienced something that was particularly traumatic, it could be a very embodied experience. And by that, I mean that there might not have been a lot of cognitive functioning around it because of the way your body reacts when you're having a trauma. So actually, or experiencing a trauma or in a trauma. And so actually, you don't have the words, you haven't got that linear way of being able to talk about things and discuss things. By being able to using the artwork, you're maybe able to start to make sense of that and to join those two parts of the brain as well, that allows you to start having that sort of cognitive, conscious way of thinking about things and what happened, and you're able to process it in that way. There's also an interesting element and studies have been done on people who have experienced some sort of sexual violence, sexual trauma, or domestic violence, or some experience where actually they were told to keep silent, and unless they didn't, and if they didn't keep silent, something would happen, something bad would happen. And the person who's experienced that long after the threat has gone away, they still hold that belief, that internal belief, that if they tell, then something bad is going to happen to them. And there's almost like a little bit of a sort of loophole, a trick in the brain, where actually by using the artwork, you're able to tell, you're able to say what's gone on without sort of triggering that I've spoken about it, something bad's going to happen. So it can be really, it can be a really, really important tool, especially when people don't have the words. The other thing that the art offers, which I think is really powerful, is a chance to grow someone's emotional literacy and grow your own emotional literacy. As I said, we embody feelings and thoughts and experiences. And actually, we might not necessarily have the words to say what that feels like, and especially for young children, but also for adults who maybe haven't had a childhood where they were able to really name what their thoughts and what their feelings were. They don't necessarily become thoughts. And so actually that emotional literacy, by bringing the feeling out into the artwork, you're able to start naming it. You're able to start naming those embodied experiences and those body experiences in a way that maybe the client hasn't been able to before. The other really key thing for me with art therapy, and it's a bit of what I touched on before, is actually that chance that the therapist has to really have something solid that they can hold for someone else for that week or for that month or for however long they're working together with someone. And by putting something on the page, it becomes external to the person you're working with, and you're able to take that and you're able to hold it and keep it safe, it has a value. Any artwork that's created within art therapy is treated in the same way that notes are. It's absolutely confidential. We keep it under 2 locks. And so by that, I mean, it's normally a locked door or maybe in a locked cabinet, but it's kept with the same confidentiality, and it's kept with the same sort of, I can't think of the word, but it has that same importance to us as everything else that happens in the room. So it's a really important part. We would never destroy someone's artwork without them giving express permission or wanting to, and that would be a conversation. And we always keep it with reverence. whatever it is, even if it's a very small mark on the page, and I've had some clients say, oh, you don't need to keep that bit, that's just, you know, and actually we've come back to it a couple of weeks later, or we've come back to it right at the very end when we've been reviewing what's been done, and actually it did hold quite a lot of importance to them, even if it was something small on the page that maybe feels quite insignificant. Okay. So we often talk, in art therapy, we often talk about this triangular relationship. And by that, I mean, we've got the artwork, we've got the client or the service user, depending on normally where they come from, how they come to you. And then we've got the art therapist. And there's a relationship between the three of us. So the artwork being one of the three of us. And one of the things that is really quite powerful is that you have this joint gaze. So the art therapist and the client can both be looking at the artwork, and the conversation can be had in a way that isn't so direct. Like it's, I don't know if you've ever had to have a difficult conversation with someone, or maybe a conversation with a teen, and actually it's much easier to do it if you're walking alongside each other rather than look each other face to face, or you're in a car, for example. In the therapy room, that sort of traditional talking therapy, you've just got two people looking at each other. Obviously you can look away or you can turn around, but actually it's very natural when you've got the artwork for both of you to be looking at the artwork and to have that joint gaze, to be working through something together, but without having to actually have that intensity of staring at each other. And it, as I said, it informs the conversation. So it will inform what the client's thinking and what the client is doing. It informs what the art therapist of what's happening in the room. So it's really a relationship that feeds into each other, all the different components. What are we doing for time? Okay. All right. So I really would like to do a really short, very short creative exercise with you all today. And I know you've got your cameras off, so hopefully it will give you a little bit of confidence to be able to sit with it and be in it. And we're going to do a little bit of a creative imagery journey. So I'm going to take some water. The first thing I'd like you to do, if you feel comfortable, is to close your eyes. And when you've got your eyes closed, I just want you to really find yourself in the seat that you're in. I'm assuming you're sitting. If you're standing, then find where you are. Feel your feet on the ground. Feel where you're being supported, whether it's by the chair or whether it's by the floor, and just really connect with where you are and who you are in the room. And with your eyes closed, I just want you to take a couple of really deep breaths. And when you're breathing in, try to breathe into your stomach. And we're going to do it to the count of 4. So in for 4 and out for 4. So in, 1, 2, 3, 4, and out for 4. 1, 2, 3, 4. We're just going to do one more. So in for 4, 1, 2, 3, 4, and out for 4. 1, 2, 3, 4. Now what I want you to do is I want you to imagine yourself in a place where you just feel absolute safety. You feel calm and you feel relaxed. And I want you to slowly find your place, yourself in that room. It could be somewhere, or that place. It could be somewhere outside. It could be somewhere inside. It could be something that's completely made up of your own imagining. It could be somewhere that you know and you've visited many times before. It could be somewhere that you've never visited but you've always wanted to. It doesn't matter. Wherever it is you find yourself, just be with that. Be with that feeling of feeling relaxed and calm and in that space. And now start to take notice of that space. Is there a sound that you can hear at the same time? Is there noise in the background? Is there a sense of light and colour? How does it feel with the rest of your body? Do you get a sense of warmth? And I want you to, in your mind's eye, I want you to just start travelling around that place and really start to experience it. Imagine if there's a smell that goes along with the place. Okay, and now you're there, I want you to start to think about what you're wearing. Have you got anything on your feet? for example, or can you feel the ground beneath your feet? Is there any important objects around you that you can see? Okay, and now holding that place in mind, I just want you to come back into the room a little bit. I'm going to count out to 4, and in that time, just open your eyes, but keep holding in mind that space that you've had. So 1, 2, 3, 4. Okay, now I can't see you, so I don't know if any of you did it, but if you did, it can be a really interesting exercise to do, to think about what that safe space is for you and where that place of calmness is for you. Sometimes it might have for you as well. It might take the person a little bit by surprise. They might have thought it's one place and actually something else pops into their mind. Some people, and if this is you, please don't panic, some people struggle to imagine something like that. So don't worry if that visualization didn't necessarily come to your mind. What I would do with clients, if we were doing this exercise, is I would then ask them to make or draw or create in some way, whether it's a big 3D structure or whether it's just an image, not just, but it's an image on the paper in pencil or pen or whatever it might be, or paint. And that place can be somewhere that they can return to when we're having difficult conversations, whether it's looking at the imagery that they've made or whether it's just thinking about it. And it can be a helpful way to just sort of to really embed that place of safety for them. And by creating the artwork, it stops it being in the moment as well. It starts it becoming something that maybe is a little bit more tangible, that sense of safety. So as I said, it was very short. I'm very aware that we've got 15 minutes left, and I want to just talk a little bit about some of the ways that art therapy is in the world and in Wales. So I've got 2 examples from practice. The first one is a case study that I worked on. It was a pilot project in the Nile and Brevin Health Board, and we worked with older adults within the older adults service. So we also, as part of the remit, was also part of the memory service as well. So not all of our adults that we worked with were actually over 65. In fact, the youngest person I worked with was 32 because they had early onset dementia. But it was a really interesting pilot project. It in the end ended up only being 3 months, but I will go into that a bit more depth and getting carried away. And then the second one that I really briefly want to touch on, and both of these will be very, very brief overviews just because of the time, but is a research project. It was actually in a Bristol school, but it's a really interesting project on how art therapy can work with children in school settings. And it just highlights those 2 ends of the life spectrum a little bit, I suppose, by looking at these 2 projects. Okay, so OATS, which is what we call the Older Adults Art Therapy Service. It was a 3-month project. It concluded in March 31st, 2020, so a couple of years ago now. As I said, it was in the Nile and Brevin Health Board. It was Welsh Government funded. So the Health Board applied for a grant in order to see if this would work and put it in place. So it was meant to be a pilot project. I'll talk about the ending in a bit, but we all know what happened in March 2020, so you probably can already guess. But the idea was that it was going to be a pilot project, and we were using it to collect data to see how art therapy would work for this particular group of people in this particular health board. And we were quite a large team, although we were all working part-time. But we were 6 arts therapists. So 2 of us were art psychotherapists and 4 of us were music therapists. The work took place in care homes and inpatient and outpatient settings, and it was really designed to bridge the entire breadth of what the service covered. Referrals came into the service, so came in to us, the arts therapists, from the older adult mental health team, which included the memory service. And in Nile and Brevin, those 2 services are actually separate, although they're often in the same building, in the same space, but they are separate services. So what we aimed OATS would offer, and what I think we actually did offer, was that we created a welcoming, safe, supportive, non-judgmental and confidential environment where patients could express themselves verbally and non-verbally. And it was designed to be a place where patients would be able to think about, express and process some of their emotions and some of their experiences. It was short-term work. We were, for the pilot project, we were there for 3 months. So we aimed to offer 6 weeks block sessions within that 3-month period. For some people, it was slightly shorter. And we didn't actually get to the point where we were able to do slightly longer. So 6 weeks was probably the longest that we did with anyone. We really hoped that using the arts would allow that communication when words were just a bit too difficult or a bit too challenging. And it's really important to consider that we were also working within the memory service. So for some of the people that we were working with, actually words are starting to be lost a little bit, and they didn't necessarily always have the words that, or couldn't find the words that they wanted to express themselves, even though they had a really clear sense of what they were trying to say. They didn't necessarily have the words that they needed. And so the arts helped offer that. And for me, when I was working, I found that a really powerful thing, was that the artwork really became a really key part of that project for that very reason. We also worked as part of an MDT, which is a multidisciplinary team. And one of the really important things that we were meant to be doing there was feeding into that team. So we went to all the weekly team meetings. And we made practical suggestions, recommendations based on what was our assessment and what was happening. So I know in the beginning I said that it's that using the artwork isn't about diagnosing, but we still make assessments as art therapists, and we're still assessing what's happening and what's going on for that person, and we feed that back, in this particular instance, to the MDT and the wider team. And in different scenarios, we'd feed that back to someone else. We also, I like to think that as art therapists, we just have a slightly different way of thinking than maybe some of the other members of the team, and that we sort of think in a slightly more creative way when it comes to problem solving. And actually, maybe that's something that we're able to offer as art therapists generally, and identify solutions that maybe are a little bit different, or have a little bit more of a different approach maybe. So those were our intentions. That was our aim of what we were going to offer. And we also wanted to offer that sort of opportunity to have that therapeutic, this is what we offered, an opportunity to have that therapeutic relationship, resulting in really meaningful work where we were able to identify what the client's goals were, that were with the person who we were working with, clinical goals, and think about them and work through them. As a team, we had a really broad range of approaches. And so we use that sort of different approaches as appropriate. And we also had a lot of psychoeducation. One of the things we're doing that sort of slightly short-term work with the 6 weeks is psychoeducation can be a really important part of it, because it allows the person to come away with maybe some understanding of their experience from a point of view that is outside of them and what they're doing. And by psychoeducation, I mean educating people about sort of the psychology of what's happening and how things happen to people generally. So for example, if someone has experienced a trauma, it's maybe talking through what your standard trauma responses are, so people can get an understanding of that if they don't have it, and be able to start to realize, or start to believe, or start to understand that their experience is very challenging and very difficult, but actually they're not an oddity, that what they're experiencing is actually in a lot of ways very normal, a normal reaction to what they experienced. And that can be really powerful, and it's really important. We did do an initial assessment for everyone, and that we met and that we saw, and based on that assessment, we created an evidence-based clinical intervention. And so by that I mean, for some people, for example, if they'd been just generally referred to the service and it was a music therapist who did the assessment, they may have noticed that actually what they would really benefit from is art therapy, and vice versa, along with a lot of other clinical interventions that came along. But that's probably the basic sort of, or the first point of assessment that we had following the more deeper clinical intervention. Okay. My watch has stopped. Right. So they reached the service. We were very much a joined up service, which was fantastic. I don't know if anyone's aware of how big the Aneurin Bevan Health Board is, but it covers geographically, it covers a lot of ground. And so we all had our own outposts, and we all sort of were in a different point of the service, sitting in the different point of the service and working within that. And it allowed us to move between settings when we needed to. And what it also meant was that we could follow patients as they move between services and as they move between from outpatient to inpatient and inpatient to outpatient. And often as well from inpatient settings to care home settings, we were able to help with that transition and help and to provide that consistency of therapeutic care as well, which I think was really powerful and really helpful. Okay, so one of the key benefits for me, one of the things that I felt was really key to this work in this particular environment, working with older adults, and particularly for me working with those adults that had some sort of memory loss, was that the art really acted as a holding space. There was times when I was working with people where they couldn't necessarily well, they definitely didn't necessarily remember my name, but they remembered who I was. But they couldn't necessarily remember what they'd done yesterday, for example. But when we brought out the artwork that they'd done the previous week, they remembered it. And they remembered what they'd made and why they had made it. And for me, that felt really powerful. There was something in the artwork that allowed them to actually hold on to that conversation a little bit. And by using the artwork, especially for those people that we were working with that maybe struggled to find words and to hold a conversation, it really reduced the anxiety of holding the conversation, because they could just make and they could just do and they could just be with the artwork and we could have the conversation that way. And so that reduction of anxiety took off a layer that was there in nearly all their interactions with everyone, that allowed a conversation to happen and just, if nothing else, alleviated that. And as I said, the artwork acted as a bit of a prompt for conversations and experiences, and it meant that we were able to hold conversations over the weeks, which is often something we naturally do in therapy, is we'll refer back to what someone maybe said last week or someone did last week or the week before or so on, and we're looking at change, or we're looking at whether something is relevant to that, to the current experience that they're having. But when you're working with someone who's got memory loss, that isn't necessarily possible. But actually the artwork was able to act as that sort of continuation through the weeks, which I felt was really powerful. Okay, so for some reason I've dropped a slide, but what effectively what happened at the end of the project. So we were all set really for the project to look for further funding for it to become a more permanent thing. We had a really high uptake of service users that wanted to use the service, and the and staff that were feeding into the service in terms of referrals. We had some really positive outcomes. Unfortunately, in March 2020, just as we were coming to the end of the project, COVID hit and all money and resources were directed elsewhere, as we all know. And also we were working with older adults. So things came to a very, very abrupt ending. And a very challenging ending, I think, both for us and for the people who we were working with, because we weren't necessarily able to finish the work for a lot of people, because we weren't able to go into the care homes, or we weren't able to meet them because of what was the very immediate known risk to older adults. So sadly, it did come to a very abrupt end, but it was a very powerful and interesting project. How are we doing for time? Okay, so I'm not quite sure we're going to quite get to art therapies in schools, but I would just highlight some of the key elements here. So this is a 2019 study, and it was really designed as a sort of a study to look at whether or not there was further research that could be done in this area, and there absolutely is. And there is a lot of research about using art therapies in schools, but this was a very tailored one, and it was a very interesting way, in terms of they had a way of working through with each child that worked really well. And what I'll do actually is I'll just skip to the images that the children created, because I think it's really nice to be able to see what some people create in art therapy. And the responses that the children gave. So one child, age 10, art therapy helps with stress. It can help children with their feelings, e.g. sadness, scared or angry feelings. When you make art, it can take your mind off the bad stuff. This can help you feel safer. And I think a 10-year-old is absolutely, in a nutshell, got one of the things that for me, art therapy can just be really powerful for. And age 5, art therapy is a place where you do art about your feelings. And that's it. That's exactly what art therapy is. It's about creating something that expresses your internal world and your feelings. Okay, so we're probably at time, Tanya, do you think? How are we doing?
You have a couple of minutes if you want to.
Yeah. Okay. Okay, so this is a couple more of the images. I think this is, so if I go, oh gosh, let me go back, right? If I go back, oh no, wrong way. No, I've done it really wrong now. Hang on. Okay. So what was really important about this particular study is that there was 10 classroom teachers were involved in the study and the evaluation and the feedback, and they all reported positive changes. They all stated that there was significant and medium effect changes for positive teacher rated changes in the child's overall stress, conduct, hyperactivity, and pro-social behaviour. So really, the art therapy acted as a holding space for some of those really difficult experiences that I think for children and for adults, but for children in class, when they haven't got anywhere to put them, it can be a little bit like shaking a bottle of Coke, and actually it explodes out in the wrong place and it all just escalates. But actually what the art therapy allowed to happen is for those experiences and those processes to happen within the therapy space. So when they were in the classroom, actually they were able to be a bit calmer, they were able to engage with what was going on, and that leads to a whole wealth of positive experiences for that child. And this study really highlights how important that was, but how key art therapy was to that process and to be able to have that space. Okay, right, I'm going to stop sharing my screen, but thank you everybody. So does anyone have any questions?
Jay was commenting on using the exercise you were doing with teenagers with traumatic backgrounds, and how successful this intervention had been, which is really great. I have a question, because I'm always curious about the boundaries between arts and health, therapeutic arts, and I love that you started with that distinction, because I think it's really important. I wanted to maybe ask you a bit about your therapeutic contract, and maybe the kind of the safeguarding or the ethical responsibilities of art therapists versus maybe other arts and health or therapeutic art. Do you say a little bit more about that?
Yeah, so I think it depends really, but essentially if you're working with a group when it's arts and health, then you'd maybe have a contract as a group, for example, of what you'd want the group to be, what you'd expect it to look like. And also that boundary and confidentiality of keeping the artwork isn't the same. So normally when you're working for arts wellbeing or arts and health, then the artwork is often, it might be for the person themselves to take home or to work with personally, but it's for others to see. So that confidentiality with the artwork isn't there. Whereas the confidentiality with the artwork when you're working as an art therapist is actually about making sure that that artwork is really held and really safe, and that boundary is really important, and maybe a really important distinction as well between the two. In terms of contracting, when I'm working as an art therapist, I have a contract with the person I'm working with, as all therapists do, and I talk through what confidentiality means, who I will speak to about anything that happens in the room. So ordinarily it will be I will take anything to supervision that I feel needs taking to supervision. There's the caveats of what I would need to report to the police or to a safeguarding officer if it was brought up in the room. So harm to self or others, drug dealing and terrorist acts are probably the real key ones. And also I'd have a conversation with them about if I'm working for an organisation, at what point that information gets taken to the rest of the team and the wider team. So for example, the project that I was doing, the older adults project, the people who I were working with, I was really clear that what they said in the space was confidential, but it was confidential within the wider team. So it wasn't necessarily just me that was having that knowledge, because that's part of working in an NHS team, really. And I'm writing notes, and so people can see them. I'm really mindful of what I do write in notes and how I relate what's happened in the room, so that I'm not necessarily talking about things that it isn't important for other people to know. And I suppose that's probably the really big difference, is the confidential element of what happens in arts and health as opposed to in the art therapy room.
Yeah, and thanks for that. That's so clear. And also, my other question was, you spoke earlier about the aesthetic kind of pressure, or then sometimes I've seen some art therapy exhibitions. Could you talk a little bit about that process versus product relationship?
I think it's a really challenging one. I think the people who actually find it the hardest, once everyone's got over that sort of element of I've got to make artwork, actually the people that find engaging with the artwork in art therapy the hardest is those that would consider themselves artists or in some way use art, because ultimately it's part of your process, your ingrained process, to create something that's aesthetically pleasing, or that ticks maybe some of those boxes of like sort of art theory. And so that could be a real challenge. In terms of the exhibitions for art therapy work, I think a lot of the time they're normally always really considered, but they are often done because the person who has been working in the client or the service user actually wants to share their journey rather than necessarily share the artwork. So I think what the artwork represents in those instances is not necessarily this is the perfect picture of whatever it is, but it's the perfect picture that represents the journey I went on during this process of art therapy. And so I think it holds all that symbolism of that change and what they experienced, maybe letting it go or just having a chance to externalize it in a way that sometimes can happen in your sort of standard art gallery show. But I think it's just a different way of viewing the artwork, and it can be problematic, I think, when people start with the view that, well, if I do this, maybe it'll go on the wall or maybe it will go out, because actually it doesn't allow them to really engage with the process.
Wonderful. Thank you for that. And Caroline says, I found that to be true in high school work. The children who didn't think they were creative were able to connect with the materials expressively more easily in some groups. So, as a overcoming a barrier. And I guess you're also running a couple of workshops as part of the Arts Therapies outreach program. Did you want to say a little bit about what's coming?
Yeah, so for me, those workshops are really, they fit more into that arts for wellbeing, that arts in health. So it's about having, and I know Emma Wheeler is doing separate art therapy workshops or sessions, sorry, I should say. And actually for me, what I'm doing, because I might not be seeing that person past that 1 week. So for example, one of the sessions is about, it's printmaking and collaging. That's the materials, that's the way that we're working. But it's about creating a book and a space where they can write their own story and take it away and add to it with images. And so it's about them having something that maybe gives them a space to express themselves, which is safe, I suppose, in the same way that a diary is a great way of processing what's going on for you. but we're in a group and everyone is seeing what everyone is doing, and everyone is going to be hopefully taking away what they're doing with pride and showing it to their family members. But even if they don't, even if it's just pride for them and they take it home and they work in it and write in it, then it's just a way of allowing them to have a space to think about things and give them a chance to learn a new skill as well. So that's sort of promoting of that well part of them. One of the other workshops I'm doing is about knots and I've forgotten what it's called now, but essentially what I'm going to be doing with them is lace making. It's one of the things that I enjoy making as an artist, which is it's very old-fashioned lace making with bobbins. But we're going to be looking at how, so I'm going to teach them a really basic technique, but we're going to be looking at how the different parts of their lives, positive parts of their lives, interweave with each other and how they all work together. And we're going to be sewing beads into it that represent things in their lives that are maybe the real key things that are important. It could be their cat, it could be going to the beach, it could be whatever it is, could be their children. And they're going to eventually end up with a really small key ring, and it's something that they can take around with them to remember all that interwoven part of their lives that actually is really positive and all those things that are important and special to them. And it's just acting as a reminder.
Wow, that sounds very exciting. All in a keyring. You're gonna do like lace that goes into a keyring.
So it's going to be a little lace square, and then it's going to sit on a fabric, felt square itself. We're going to sew it into felt square, and then it's going to have a keyring attached to it. So.
Very cool. Textiles. So it's working with textiles.
Yeah.
Oh, that's really great. Does anybody have any other questions for Sarah? I mean, you can also unmute yourself if that's easier. It's so interesting because you now you're kind of looking at other media. So for people who are not familiar with art therapy, a lot of your pictures have to do with drawing, but there's also all sorts, right?
Yeah, absolutely.
Yeah.
I take a little kit with me, like a little box, and it's got bits of clay in it. It's got things like, it's got beads and thread and string and a little tiny bit of astroturf. So if someone wants to make something out of that, which they have and do, along with paint, charcoal, pens, pencils, all that sort of thing, all the sort of standard things you think of with art. But it can also be about making something with what's in the room as well, sort of whether it's making something with the chairs or whatever it is. So it's sort of, could be anything really.
Wow, that's really, really interesting. Because all these kind of artistic media will elicit different things, I guess. So that's one of the things that I've gotten from working with arts therapists, that the media is the most flexible part of that interaction, because an issue might be best expressed through, I don't know, like you said, lace, or it could be that representation is really interesting.
And I think it's really interesting watching clients. For me, it's really interesting watching them switch between different materials and how, and sometimes for me, it can represent sort of where they are in that time. If, for example, they often pick up clay and then they change their mind and pick up pastels, there's something in that for me that can be really powerful to think about and discuss. So the materials themselves can be part of the conversation. There's a real classic thing in art therapy where someone just empties a whole tube of paint on the floor, and that sort of symbolism of maybe mess and just sort of letting something go can actually be like quite stressful as an art therapist. You've got to clean it up, but actually it can be really powerful for the person who's doing it, or just a powerful way of really showing what's going on for them, what their internal world looks like.
Definitely. And yeah, this is the common thread, is like it's just so interesting with all the different modalities, how that symbolic content keeps getting, is brought out, is expressed, and is also channeled through all these really powerful elements of the arts. That's just really, really important. So thank you so much. I'm really, really excited about your workshops, and and with your private practice, will you be able to, if people are interested, do you want to pop in maybe your social media or your I don't know, Instagram.
Yeah, I put
Emails
I
down.
put the website up. It's probably the easiest way. And then through this you can access all the social media as well, which we're not great at, I have to say, but it's there.
Yeah, the way to contact you. And are you specializing in any particular client group in your private practice, or is it more children or adults, or?
No, so it's sort of, at the moment I have a large number of young people, but as I said in the past, it's always been a lot of older adults. So it comes in waves and cycles. So really for me, it's just about meeting that person for who they are and where they are, and hoping I can meet their needs. And if I can't, it's finding someone that's appropriate.
Oh, brilliant, brilliant. Well, thank you so much. It's great. Angela says, thank you, Sarah, for representing art psychotherapy, and especially differentiation between art well-being and psychotherapy. Yeah, I think that's so important, because the word therapy has been thrown around quite lightly around, and I do encounter these art therapy books and workbooks, and it's a really, all the arts therapies require this postgraduate training. We have that at USW, for some courses, but all over the world, really. And even if you're trained in traditional, maybe I say traditional, but more verbal therapies or counseling, is still a very specialized way of working, which is, you've kind of highlighted in your presentation.
It's a very rigorous training. I think that's the thing that's important to know. It's rigorous, and it's as you say, it's specialized. So it's about celebrating that as well.